Hello, I'm Jennifer Smith. I'm a volunteer pharmacist at MLK Health, and today we're going to talk about diabetes medications. So many of you may have heard another medication that is used for patients with diabetes is insulin, and this is to supplement your body's insulin when it cannot produce enough or enough to control your blood sugar in your body. And so there are many different types of insulin. Some are short acting, some are long acting, and most patients end up on a combination depending on their needs. So hopefully we're going to talk about the different types of insulin that are available, and hopefully you'll hear about the ones that you have been prescribed. So the first group of insulin we'll talk about are the rapid-acting insulin. So we have insulin aspart, insulin glulicine, or insulin lispro. And these are brand names Novolog, Humalog, or Apidra, and they're kind of the most common ones. These medications are very important to be taken with food because they're very quick acting, and so you want to take them with food when you're getting ready to eat a meal because they will lower your blood sugar more quickly. So we also have insulin that is short-acting regular insulin, or Humulin R, Novolin R, and this is short-acting. It's a little bit longer than our really rapid-acting, so it's not quite as quick of an onset. But again, we recommend taking it with food, so it shouldn't be taken unless you're eating a meal or eating food. We also have NPH insulin, which is an intermediate acting insulin, and this is one that a lot of people are on combined with a shorter acting insulin, because you can take NPH insulin often once or twice a day, and it acts almost like an underlying control medication to keep your blood sugar under control throughout the course of the day. So another group of insulins that we have are our long-acting insulins, and these are long-acting, and they are often referred to as basal insulin. So you can remember that by thinking that it's the base of your regimen. So they provide a low level of control over the course of the whole day, and they mimic kind of what your body would normally do to control your blood sugar. So they're often taken just once or twice a day, and in addition sometimes to other medications that will help you with your needs around a meal when you eat. So these basal insulins are less associated with food, so it controls just the base level of blood sugar in your body. So examples of these basal insulins, we have Lantus or Levemir, are kind of the most common ones. You may also see Basaglar, which is a newer one. Those are the brand names for medications, but those are often your base regimen for providing control over the course of the whole day. So there are a couple other types of insulin that you may end up using. They're a little bit less commonly used because they are for very specific patient populations or when you have specific needs. But we have the kind of ultra long acting insulins, that's what they're called. And these are Tresiba or insulin deglutec, or Toujeo, which is insulin glargine, but it is a more concentrated form of insulin. So especially if you end up needing a large number of units of insulin, we sometimes can switch you to Toujeo to reduce that need for a larger injection. So some people, if they need a larger number of units of insulin, it gets to be kind of a large injection, or you may have to split it into 2 shots, and so we try to avoid doing that. So if we need to, sometimes it's possible to switch you to that more concentrated form of insulin to reduce your number of shots per day. There are also some mixtures of insulin, so you may have heard of these. There's kind of 70-30 or 50-50, but these are mixes of insulin that are pre-mixed so that you don't have to mix the insulin yourself. And these are usually a combination of an intermediate acting insulin and a short acting insulin. So it's something that you would take maybe twice a day with meals, and so that long acting insulin provides some coverage for the kind of base part of your regimen, so over the course of the day, and then the shorter acting component of it covers you for the meal that you're about to eat. So for example, you might take a dose with breakfast, and so the short acting portion would cover what you need to control the blood sugar for breakfast, and then the longer acting portion of that injection would cover you through dinner, through lunch, and kind of provide the basal coverage for the day. And then in the evening, you might take another shot of that combination, and so the short-acting component in that would cover you for your dinner meal, and then the longer-acting portion of that shot would cover you over the night and provide that basal insulin so that you would have a base coverage of insulin throughout 24 hours, and then have that extra coverage for your meals during the day. So thank you for listening. I hope this information about diabetes medications is helpful. Again, if you have any further questions, concerns, please feel free to ask your provider, your pharmacist, and we're happy to answer questions and make sure you can use your medications safely and effectively and get the most benefit from them. Thank you.